Hello friends, myself Dr. Sanjeet Kumar. Today we are going to continue the same topic, decomposition. The difference between putrefaction and gangrene. So first, putrefaction is post-mortem sign, but in gangrene it is ante-mortem sign. Area involved in putrefaction all over the body, but in the gangrene localized. Demarcation line between living and dead tissue absent in the putrefaction but present in gangrene. Associated changes like pus or inflammation absent in the putrefaction but present in gangrene. Then conditions modifying putrefaction. Putrefaction promoted by and putrefaction retarded by. The promoting factor is external factors like temperature begins at above 10 degrees centigrade, but optimum temperature is 21 to 46 degrees centigrade. But below 0 degrees centigrade and above 48 degrees centigrade, because tissue becomes dry, this is the retarding factor. Then surrounding moist is the favoring factor. Organ containing water decompose rapidly. Dry, dehydrated and organs with low water content like prostate or bone, they retard decomposition. Then flow of air. Body is kept in open, they promote putrefaction, but airtight coffin and body is completely submerged in water, these are retarding factor. Then manner of burial. Body is buried without clothes or coffin in porous soil, they promote putrefaction, but body is fully covered with clothes and the body is placed in tight fitting lead coffin, they retard the putrefaction. Internal factor age. In children putrefaction is fast, but in infant, young adult and old age, they retard the putrefaction. Then condition of body. Fat and flabby body due to retention of heat, they promote the putrefaction, and thin and emaciated body, they retard putrefaction. Then cause of death like gangrene, acute infection, septicemia, strangulation, suffocation, chronic alcoholism, they promote putrefaction, but in accident, violence, acute poisoning of arsenic, cyanide and organophosphorus compound, strychnine poisoning, heavy metal poisoning, they retard putrefaction. A temperature increase of 10 degrees centigrade usually doubles the rate of most chemical process and the reactions. The rate of decomposition is about twice as rapid in summer than in winter. Decomposition may differ from body to body, from environment to environment, and from one part of the same body to another. The frozen body will not undergo decomposition until it defrosts. If the decomposition has already set in, refrigeration of the body may not stop decomposition completely. Then differential decomposition means a situation where the one body shows differential stage of decomposition in different part of the body. Sometimes one part of the body may be mummified and while the rest may liquefying putrefaction. Body form. It is a research facility dedicated to the estimation of time since death. Bodies are exposed to different ways to decompose. All stages of decay, animal activity, smell, body temperature and the weather condition are recorded. It is for gaining the better understanding of decomposition process. Skeletonisation, it varies considerably and mainly depends upon the ambient temperature, insect colonization of the body and scavenger activity. In India, an uncoffined buried body is reduced to skeletonization within 1 to 2 years. Factors modifying rate of skeletonization. Access to air, acidity of soil and the acidity of soil water, amount of soil water, climatic and seasonal variation. Then maggots. Maggots is produced in 1 to 2 days, which has proteolytic enzyme that dissolve the tissues. As they eat, they can create holes that resembles gunshot wound. An unusually large accumulation of maggot on one area of the body may indicate pre-existing antemortem wound. The maggots become pupa in 4 to 5 days and adult flies in the course of 3 to 5 days. Decomposition and the maggots activity increase the temperature of the body. It helps in estimation of time since death. These are the maggots. Then poison which hasten putrefaction like chronic alcoholism and hydrogen sulfide poisoning. Poison which delayed putrefaction, carbolic acid poisoning, heavy metal like arsenic poisoning and strychnine poisoning. Then poison which resists putrefaction like barbiturate poisoning, corrosive poisoning, cyanide poisoning, dhatura poisoning and the organophosphorus poisoning. Poison which are destroyed by putrefaction, aconitin, morphine and succinylcholine. Then medical importance of putrefaction. To estimate time since death, cause of death becomes difficult to ascertain except in the case of firearm injuries, fracture, poisoning and drowning. Poisons can hasten or delay decomposition, can resist decomposition or may destroy during decomposition. Infanticide, level of diaphragm may spuriously be altered by the gases of decomposition. These are the medical importance. Then important question related to cadaveric spasm. Which one of the following is false regarding the cadaveric spasm? It may resemble cadaveric rigidity. It may develop in paralyzed limb. Develops instantaneously after death. All of the above. तो paralyzed limb में develop नहीं करता cadaveric spasm. This is false. Following is not true regarding cadaveric spasm. Involves only a particular group of muscles. Instantaneously develop after death. Resembles rigor mortis. Depletion of ATP. Depletion of ATP नहीं होता इसमें. This is false. Cadaveric spasm may be seen in homicide, suicide by cut throat, death from drowning, all of the above. All are true regarding cadaveric spasm except seen in accidental cut throat. Maybe is not known true. Very strong force required to break it. ये भी सही है. Manner of death can be commented. ये भी सही है. तो which is not true about cadaveric spasm. Primary flaccidity is absent. True. Sudden death may be a predisposing factor. ये भी सही है. It is antemortem sign. ये भी सही है. Freezing and exposure to temperature more than 65 degrees centigrade will produce cadaveric spasm. This is false. Then important question related to decomposition. The surest sign of death is absence of breathing, absence of coronary reflex, discoloration of right iliac fossa, absence of heartbeat. Then maceration means septic autolysis, aseptic autolysis, putrefaction, none of the above. Then appearance of maggots on the body indicates place of death, cause of death, type of death, time since death. Then fourth, according to Casper dictum, putrefaction in air, water and earth occurs in the ratio of 8:2:1, 1:2:8, 1:2:4, 4:2:1. The next, the following type of poisoning delay the putrefaction of the body: copper poisoning, arsenic poisoning, mercury poisoning, dhatura poisoning. Most important enzyme in putrefaction is coagulase, lecithinase, hydrolase, none of the above. The earliest external sign of decomposition is marbling of skin, greenish discoloration over the right iliac fossa, peeling of skin, appearance of foul smelling gas. The earliest internal sign of decomposition is softening of the brain matter, discoloration of larynx and trachea, discoloration of inner surface of aorta, discoloration of under surface of liver. The next, postmortem hemolysis of the blood is mainly due to Clostridium welchii, E. coli, Streptococcus, Staphylococcus. Then honeycomb appearance of liver is seen in dry drowning, wet drowning, immersion syndrome, decomposition. The next, flowing factors influence rate of putrefaction except age, sex, free access of air, moist environment. In summer, foul smelling putrefactive gases may be collected as early as 12 to 18 hours, 18 to 24 hours, 24 to 36 hours, 36 to 48 hours. Last organ to putrefy lungs, liver, spleen, uterus. During decomposition, usually collicutive putrefaction begins in 2 to 3 days, 3 to 5 days, 5 to 10 days, 10 to 15 days. Casper dictum is related with identification, drowning, putrefaction, hanging. ये 15 क्वेश्चन का आंसर कमेंट में करना है. दिस इज ऑल अबाउट putrefaction. Okay, thank you for watching.